Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry, with this week's version of Dental Health with Dr. C. I want to talk about gum disease today. It's an incredibly serious and epidemic problem in this country. If you have gum disease, you have a chronic infection going on in your gums. Now this creates some problems. You're more likely to have a heart attack or stroke, adult onset diabetes, certain kinds of cancers. So why is it so common? Well, we all have some tendency towards having gum problems. And a lot of it's genetic, and no matter how hard you try, these problems are going to exist. 90% of the people in this country have some level of gum disease. Now it could be minor like gingivitis, but it could be a lot more serious like pyorrhea or periodontal disease, where the bone itself that holds the teeth in your mouth are affected. So if 50% of us have serious gum problems in our mouth, why do 4% of us get treated? Well, the problem is that the surgery necessary to take care of these acute and serious chronic gum problems is not that much fun. Traditionally, you go to a periodontist, he picks up a scalpel, cuts the gum tissue away from the neck of the tooth and lays open all the bone, recontours the bone. We're not particularly good as a profession at putting bone grafts around the neck of the teeth, and we sew you back up. This causes a lot of discomfort. As a result, there's people you can't pay to go and get their gum problems handled. So now what do? Well, fortunately, over the last 10 years, there's a technology that is unbelievably exciting that's come on board. It's called LANAP. It stands for Laser Assisted New Attachment Protocol. Now with this protocol, you can actually do gum disease without ever picking up a scalpel or a suture. The pain is dramatically different. We've been doing this at the Coleman Center now for the last few months, and the results are amazing. People are taking a few Motrin and coming back and saying, I can't believe how good this is. This technology is really set up so that the wavelength coming out of the laser focuses and goes after dark pigmented bacteria. It's that bacteria that causes gum disease. This will not cut anything that's healthy. So I can run this beam on my finger, and you know what happens? Not a darn thing. I can put it on a carpule of anesthetic, those little glass things we numb you up with. I can run it on the glass doesn't heat up, the fluid doesn't heat up, but the dark pigmented print on the other side of the carpule will disappear. How unbelievable is that? So this radiation actually gets down into the tissue, killing the bugs that cause the problem. It also stimulates the bone to, you know what, grow back. I can't even believe it myself. I had trouble getting involved with this technology because I couldn't wrap myself around that. This will actually cause bone to grow back around the teeth. So if you've been root planing multiple times in your life and you're a little tired of saying, okay, I'm going to do this for the 4th time, or if you've been reluctant to go to a periodontist to have traditional gum surgery done, or if even you've told that you have some teeth that are hopeless and these things have to come out, maybe there's an alternative. Why don't you give me a call? Paul Coleman, Coleman Center for Cosmetic Dentistry. And that's this week's Dental Health with Dr. C. Talk to you next week.